In this session, we will talk about the topical antimicrobial medications used to treat minor skin infections. We'll first focus on antibacterial agents. We have several reasons we might use an antibacterial topical agent. We may be using it to prevent an infection in a clean wound or prevent progression of an infected wound to a more serious infection. The two major types of pathogens that we'll deal with here are the beta hemolytic streptococci, group A, and Staphylococcus, specifically Staphylococcus aureus. These are two major bacteria that live on the skin surface as the normal flora. Now, if we're talking about surgical wounds, we do have to think about specialized pathogens that could be in an environment in which the surgery was performed. The first agent in this category is Bacitracin. It's probably very familiar to you. It's an over-the-counter product and is included in many different antimicrobial agents. It's a peptide antibiotic, and it works by forming small holes in the bacterial cell membrane. It's active against gram-positive pathogens like streptococci, pneumococci, and staphylococci. It often comes in an ointment-based product and is combined with other antibacterial agents like Neomycin and polymyxin B. It's poorly absorbed through the skin, so systemic toxicity is negligible. Bacitracin is a common agent in a lot of first aid kits. Polymyxin B is yet another agent, usually in an over-the-counter form, combined with bacitracin and Neosporin. It is active against gram-negative organisms, so it provides a nice complement to the other agents that we'll talk about. Gram-negative organisms can include E. coli, Pseudomonas, Klebsiella, and others. Polymyxin B also has minimal systemic absorption, so we don't have to worry about systemic effects of topical application. The third very common first aid antimicrobial is Neomycin. This is the product that gives Neosporin its name. It's combined with polymyxin B and with bacitracin in a lot of products. Now, Neomycin can cause some allergic contact dermatitis in some folks, especially if it's applied to eczema areas. Though it is something to be aware of, but it's not a very common reaction. Neomycin is an aminoglycoside antibiotic, and it works by interfering with bacterial protein synthesis. The first prescription product that we'll discuss is Retapamulin. The brand name of that one is Altabax. It inhibits bacterial protein biosynthesis and is therefore bacteriostatic, not bactericidal. It has activity against gram-positive aerobic bacteria as well as group A beta hemolytic streptococci and Staph aureus. It's indicated for treating impetigo and other superficial infections caused by susceptible organisms, and it can be used in patients as young as 9 months old. It doesn't show any systemic absorption, so we don't have to worry about systemic adverse effects. Mupirocin is another prescription antimicrobial agent. The brand name of it is Bactroban. It is an antibiotic that inhibits bacterial protein synthesis and has activity against gram-positive aerobic pathogens, Staph aureus, including methicillin-resistant Staph aureus, as well as group A beta hemolytic streptococci. Mupirocin is indicated for cases of impetigo or superficial MRSA infections and folliculitis. You can also use it for localized wound infections. It doesn't have any systemic absorption, so again, we don't have to worry about systemic adverse effects. Ozenoxacin, or Zepi, is another cream-based product. You've probably heard of fluoroquinolone antibiotics. This product is a non-fluorinated quinolone antibiotic. It works by inhibiting bacterial DNA replication. It's especially useful against Staph aureus, including MRSA and strep pyogenes, both very commonly seen in skin infections. Its indication is for impetigo in patients even aged as young as 2 months old. We don't have to worry about systemic effects in this drug either. Silver sulfadiazine, or SSD, is a product used specifically for burns. It binds to DNA and inhibits replication of bacterial cell wall and cell membrane components. It's a good broad-spectrum antibiotic, active against gram-negative and gram-positive organisms, even some fungi. It does have activity against MRSA. It's worth noting that there is the possibility of cross-sensitivity with people who are allergic to sulfa drugs. It's not a common reaction, but it is something to know if a patient is going to be especially applying this to a large area of the skin. Now let's transition over to antifungal topical agents. These are used to treat superficial fungal infections. Some cases may require oral antifungals, so you may see a combination of the two. The main pathogens at play here are Candida, dermatophytes, and then the special situation of a fungal infection of the fingernails or toenails called onychomycosis. Based on the location of the infection, we may select one product over another. Tinea corporis infections can pretty much be treated by any of the antifungals. Tinea pedis, which is athlete's foot, also can be treated by most of the antifungals. And then Tinea versicolor is usually treated with azoles or allylamines. If it's a case of Candida infection, then the drug of choice there is nystatin. Now, when do we consider oral antifungal therapy? Those cases where there's a lot of skin involved. If the scalp in particular is involved, it's difficult to treat topically. If the fingernail beds or toenail beds are involved, that is a case for oral treatment. And if any mucous membranes are involved too, that's when we really consider moving to oral therapy. Oral antifungals come with a lot of drug interactions and monitoring requirements. So these types of infections need to be assessed very carefully before oral therapy is prescribed. It's important to realize that Tinea pedis and Tinea corporis may look differently in people of different skin tones. Lighter skin tones may have a red, roundish, and flaky appearance, whereas darker skin tones may look very differently, like a lighter, demarcated lesion. Tinea versicolor is another type of fungal skin infection that presents as skin discoloration, perhaps not as much of the scaliness that we see in ringworm, but it can appear on the neck, trunk, and arms and legs. Tinea capitis appears on the scalp. It may or may not involve loss of hair in the infected area. You can imagine in places that are more hairy on the skin, may have a more difficult time getting a topical drug to the affected area. So in cases of Tinea capitis, that's why we do consider more quickly oral antifungal therapy. Here's a summary of the topical azole antifungals. They include things that may be familiar to you like clotrimazole and miconazole, as well as some prescription products, econazole, ketoconazole, luliconazole, and sertaconazole. I've listed the dosage forms that are available in these various drugs. Based on the location, the extent, and patient preference, you may choose one dosage form over the other. There are only 2 topical allylamine antifungals. They are naftalin and terbinafine. They also come in a range of dosage forms. Terbinafine is specifically marketed for athlete's foot or Tinea pedis. In these photos, you'll see examples of candidiasis. Candida can infect multiple body sites and requires a different approach to antifungal treatment. If the patient has a oral thrush infection, that is Candida infection of the mouth and oral structures, it may require an oral product to be applied to that area. Candida is the most common cause of vaginal yeast infections as well. If the infection involves places that are hard to keep dry, a nystatin product that is in a powder form may actually help keep the area dry and treat fungal infections also. The mainstay of treatment of Candida infection is nystatin. It is a polyene antifungal and the only one in this subclass. Nystatin comes in lots of different dosage forms, and based on the location and duration of therapy, you may choose one over the other. When a patient has a fungal infection of a nail, either a toenail or a fingernail, it is notoriously hard to treat. The organism should be confirmed before starting oral therapy. Oral therapy comes with a lot of drug interactions and monitoring required. And usually, nail fungal infections do require oral treatment. That being said, there are 3 topical antifungals that are specifically intended to treat nail fungus. The one that's been on the market the longest is Cyclopirox. The brand name of that is Cyclodan or Loprox or Penlac. The Penlac product is in the form of a nail lacquer that is applied to the nail that is infected. Tavaborol is brand name Caridin, and efinaconazole is Jublia. These both come in a topical solution that is applied with a dropper to the nail that is infected. All of these products have to be used for a very long period of time to get resolution of the infection. The manufacturer suggests upwards of 52 weeks of treatment. You can imagine that is a huge time commitment as well as quite a bit of cost the patient will incur to treat. But a topical agent may be the only option when you have a patient who has contraindications to oral treatment. Now let's talk about some antiviral agents we use for viral infections of the skin. Specifically, we are covering herpes simplex virus, varicella virus, and HPV, human papillomavirus. These drugs that we'll talk about, antiviral agents, are used to treat cold sores or fever blisters of the mouth, both inside the mouth on the oral structures or the outside on the lips. We can also treat topically genital herpes lesions, and in a patient who has shingles, it can be used to treat the outward manifestation of the shingles virus on the skin. Acyclovir is the gold standard agent. It's active against the herpes simplex virus. It can be used both for herpes simplex 1 and herpes simplex 2. The topical cream can be used to treat cold sores, and it can be used to treat exacerbations of herpes simplex 2 or genital herpes lesions. It can be applied up to 5 times a day and generally requires a lot of frequent application to be effective. There is a special oral tablet that is designed to sit on the gums and mucous membranes of the mouth to treat inside cold sores, so on the inside of the lip or on the gum. Pencyclovir is another agent that is active against HSV. We use it generally for cold sores. Patients have to apply both acyclovir and pencyclovir at the first sign of a cold sore. Usually people say it's a tingling or swelling around the lips. Docosanol is a third antiviral topical agent active against herpes simplex. It has the benefit of being available over the counter. It's indicated for cold sores. It can be applied up to 5 times a day to the affected area around the lips. And it also must be applied at the first sign of a cold sore developing. Our final category of medications that are available topically are the antiparasitic agents. These are generally used for lice and scabies. The 3 that we'll focus on are permethrin, lindane, and malathion. It's really important to keep in mind that these agents cause neurotoxicity and paralysis in the parasitic organism. They also can do the same toxic effects in a human if they are applied to broken skin, to large areas of the skin, or for longer periods of time. They are really intended for a 1 or 2 treatment regimen, and they are generally washed off after a treatment period. Because of the increased permeability of skin in children and elderly patients, these agents should be used with even more caution in special populations. Only permethrin is approved to use in infants. They must be over 2 months old at that. These products do come in a variety of lotions, creams, and shampoos to treat the area affected by head lice or scabies. And here again, depending on the extent of the infestation and the location, one product may be more preferable over another. Thanks for joining me for this review of topical antimicrobials for skin infections. I'm Dr. Amber Cann. I'll catch you in the next lecture.